The February Louisville Metro Board of Health meeting is called to order. On behalf of the board, the chair wishes to extend our condolences to the mayor and to his family on the passing of his mother, Ruth Greenberg. Hang on just a second. For me, everyone out there. Ted Smith is trying to get in as well.
And this is Margaret. I'm on the phone. I don't know why I'm having trouble with the link again.
Okay, well, we're just
that notify host.
Thank you for identifying. If there are any board members who are on the phone and not showing, please indicate that you're on.
I've done the notify your host thing. Can you tell that I'm trying to get in?
Yes. Catalina can.
Okay.
Thank you, Margaret. Ms. Hammond. All right, let's try this again. On behalf of the board, the chair wishes to extend our condolences to Mayor Greenberg and his family on the passing of his mother, Ruth Greenberg, a long-time, highly recognized educator and community volunteer. May she be at peace knowing that her community service commitment is living on, in part, through the mayor's public service. Before Vice Chair Bautista Cervera introduces our speaker, the city's acclaimed director of the Office of International and Immigrant Affairs, a few items of governance. First, the draft minutes of the January board meeting were included in your pre-read materials. Are there any revisions, corrections, questions, etc.? Hearing none, the chair will entertain a motion to approve the January 2024 minutes.
So moved.
Is there a second?
Second.
In all in favor, aye.
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 Okay, thank you guys. Opposed? Abstentions? The meeting minutes for the January 24th board meeting are approved. Second, and I don't see on my screen, but that doesn't at this point mean anything. The chair would also like to personally thank Dr. Paul McKinney, Interim Dean of the University of Louisville School of Public Health and Information Services, for representing the university as an active community advisory board member. In April, we look forward to welcoming the new dean, Katie Cardarelli, who is giving up Big Blue for Red and Black. And we look forward to her moving the School of Public Health toward national prominence. At this point, let me see. Tony Zippel, are you on?
I am.
Yes. Great. The chair would personally like to thank immediate past Vice Chair Tony Zippel for his innumerable years of contributions in the area of public health and in whole health as a whole. I am indebted to his putting up with me personally and to the work that he has done. In recognition of that, Mayor Greenberg on February 7th issued a proclamation that I will read you. It's not long, recognizing Tony on behalf of the city for his dedicated countless hours of service to the community as a distinguished member of the Board of Health. Tony has contributed to the well-being and safety of our community members and has demonstrated exemplary leadership, professionalism, and expertise in addressing various health-related challenges facing our community. His passion for promoting public health has inspired and mobilized others to actively participate in initiatives that enhance the overall health and quality of life for our residents. The city will be forever grateful for his service. And I might add, the board as well. Congratulations, Tony. We know that the space that was filled by the Board of Health is now filled by something else. And I hope that's a priority and inspiring and all that you want and more. Thank you so, so much.
Well, thank you, Heidi. I'm honored. It's been such a pleasure to be on the board for so many years and have the opportunity to contribute. And you're right, I'm spending my time working on issues related to resilience and trauma for young people and adults, working with a variety of community organizations. So I'll keep pushing. And as I said to you when I submitted my resignation, if there are ever ways that I can be helpful to the board, let me know and I'll be there.
Well, careful what you ask for. But thank you so much.
My pleasure.
Moving on here, and actually before I do, are there any city-directed motions to approve any public health department activity that we need to take on at this point? Otherwise, we will do that right after our perspective session. Hearing none, we are honored to have a man whose life and achievements are an unmatched asset for our city at this particular time in our history, as the second top city for welcoming immigrants designated by the federal government. At this point, I will yield the floor to Dr. Bautista Cervera to introduce Director Amos Izerimana, and I hope I have not butchered that, who will share perspectives in part on the unmet healthcare needs of the immigrant population. Dr. Bautista Cervera from Mexico City.
Good morning, everybody. Thank you so much. It's a real pleasure to welcome Amos Izerimana as Director of the International and Immigrant Affairs for Louisville Metro Government, where he is responsible for promoting equity, welcoming initiatives, and inclusion of immigrant and refugee communities. This office, the one that he leads, helps facilitate equitable access to opportunity by developing strategies, policies, and programs that advance welcoming, integration, and success. Amos served over 2 years as program manager and interim director of the Office for Globalization, leading the city to become redesignated as certified welcoming. So this is thanks to his intervention and hard work. He spearheaded efforts to develop Louisville Metro's language access infrastructure, led to COVID-19 pandemic recovery programs with community partners and immigrant-owned businesses. He holds a master's degree in international law from the United Nations mandated University for Peace, a master's degree in conflict resolution from the Heller School of Social Policy and Management at Brandon University, and a liberal arts degree in peace and social justice studies from Berea College. He, as some of this present on this meeting, is a foreign born. He is a native of Burundi. Amos was resettled to Louisville in 2007 after spending 12 years in a Tanzanian refugee camp. Thank you so much for agreeing to join us and to share your perspective. Welcome, Amos.
Thank you, Dr. Patty, and thank you, Chair Margulis. And thank you all for inviting me to speak with you all this morning. I hope you can hear me well. I'm having WebEx issues on my computer, so I'm joining via phone, and I hope this will work out
It's
just
perfect.
right. Okay,
It's
great.
perfect.
All right. Well, again, thank you for inviting me, and I see my colleague here, our program manager, is also joining us. So if there are any other questions, I'm sure she'll be able to answer some of them in the chat, but I will try to keep up. Catalina and Arlena, are you all able to share my presentation?
We've got it up.
All right, great. Well, as Dr. Patty mentioned, the Office for Immigrant Affairs in its current form was created by Mayor Greenberg in January of 2023. And prior to that, you all may be familiar that we had the Office for Globalization, which was under our Department of Economic Development. Mayor Greenberg elevated the office into the Mayor's Office of Equity. And so we've had a little bit of a shift since its creation in 2023, but really a lot of continuity in terms of the need for our foreign-born population, but as well as ensuring that we're creating sort of operational excellence throughout the enterprise. You could go to the next slide. In its current form, our vision for the Office for Immigrant Affairs is to help ensure that Louisville is a welcoming city for all. Dr. Patty mentioned that we were the second city to be designated as a certified welcoming city across the nation, and that's something that we're very proud of. And in 2022, October 2022, that designation was renewed after a rigorous process of reviewing our welcoming infrastructure here in Louisville. And so our mission is really dedicated to promoting inclusion of Louisville's immigrants, refugees, really just promoting the inclusion into our civic, social, and economic life of the city from the ways that we engage our constituents, as well as promoting civic engagement in terms of running for office or being involved in boards and commissions, which I see you all have done pretty well in recruiting folks from all backgrounds in this board. And so we work with community partners throughout the city to help facilitate equitable access to opportunity for our foreign-born populations. And we do that by developing strategies, policies, and programs that advance inclusion in all spheres of our city. If you can go to the next slide. Again, as mentioned, our foreign-born population is increasingly growing. You might have been hearing this number being thrown around from 2011 to 2021. Our foreign-born population increased by nearly 50%. And at that time, we were designated as the largest metro, or the third largest metro for percentage growth in the foreign-born population. And really for a city our size, that's significant, right? And so at the moment, in terms of projections, we're looking to that we may have about nearly 20% of the foreign-born population, 20% of the population being foreign-born in 2040 here in Louisville. And so sort of the need for this work has never been more important and more critical as we really create the infrastructure, not only to welcome newcomers, but also to retain them right here in our city. Next slide, please. So where are our communities or our newcomers coming from? We have about 100 countries represented here in Louisville, and they speak over 150 languages and growing. And so again, for a city like Louisville, that's really significant. Recently met with my counterparts from across the country, and I was surprised that San Francisco, for example, only has about 74 languages spoken. And that's really, for me, it was a place of pride to be able to share. We have over 150 languages and growing in a city like Louisville. So where they're really coming from, again, you can see on this chart, our largest newcomers are really coming from Cuba. We've had an increase and continuous growth in our Mexican-American population here in Louisville over time. India is another area of origin, Vietnam, the Philippines, China, Bosnia, and specifically a few other countries or origins are growing. Democratic Republic of Congo right now is the largest. We're receiving the largest newcomers from DRC through refugee resettlement. And over time, we've had Iraqi newcomers as well as Somalian newcomers growing. We had a bit of a pause with our Somali population, but that's beginning to pick back up. But these are really some of the largest populations that we're seeing in Louisville. And our drivers of growth, as I mentioned, refugee resettlement. President Biden increased the number of refugees that can be admitted into the United States when he took office. Before that, we were seeing the the projected number was 65,000, and that's a number that the president gets to designate every year of how many how many refugees the United States can admit. And so for his past 3 years, since President Biden took office, he has projected, or at least had a goal of 125,000 refugees being admitted. And really, if you think about it, that's really just those who are designated as refugees by the United Nations. So it doesn't include humanitarian parolees or any other interns that may be admitted. In 2021, as you all might have heard, the Afghani parolees were admitted in large numbers, and that number was not counted as part of that 125,000 that would come through refugee resettlement. Next slide, please. And so what do we do at the Office for Immigrant Affairs? We approach our work under themes of welcoming, inclusive, and empowering. And really what that means for us is that welcoming our newcomers is one step. We must also ensure that they're included in our decision making, as well as the overall health of our community. And that really means that we create an environment that empowers them to be able to do so. And so we do that by promoting inclusion of immigrants and refugees through metro government, but also our local organizations and businesses. We help facilitate access to opportunity through increasing greater access to city resources and services. And we also promote welcoming initiatives, again, with both metro agencies and local organizations. Next slide, please. So how do we do that? We look at our work in sort of three ways. We communicate. We really see ourselves as the conduit between the metro and the community to communicate information and resources that are available through the city. We also convene our various partners, both from diaspora community organizations, workforce development, nonprofits, government agencies, etc., really to develop some of these strategies and brainstorm ways that we can be more welcoming and more empowering to our foreign-born populations. And finally, we connect sort of public policies, best practices, and data around ways that our city can be more welcoming, not only through Louisville Metro government, but also through our various activities in the city. And so really just want to highlight some of our programs that we've developed to really help us do this work and ensure that there's continuity through our newcomers and those that are growing up and really creating a new home here in Louisville, either through citizenship or other means. So our Global Louisville Leadership Academy is our flagship program, really focused on empowering newcomers, especially those who are leaders in their communities, to gain their knowledge and networks to be able to connect their communities with available resources and networks throughout the city. And really, in addition to developing that leadership capacity, alumni become a part of our larger network of international leaders here in Louisville who really have been critical to the work that we do. You all might be familiar with, our COVID pandemic response. A lot of the Leadership Academy alumni stepped up to help us better serve and ensure that everybody in our community was staying safe. And so as of the end of 2023, we had about 140 alumni of the program. And we're here starting our new cohort, our 10th cohort, in a few weeks. And the other thing that we've learned through this program is that we're seeing a lot more youth coming mostly through our resettlement programs. And there's always a need to empower youth into leadership, into leadership as well, not only for their communities, but also for our community's future. And one notable thing that has helped us do that, we've collaborated with the Center for Health Equity in the last year's cohort to offer opportunities for alumni of the Leadership Academy to engage with public health. I believe we had about one or two graduates that ended up completing a fellowship within public health and wellness. And so that is really a critical component of the work that they're doing to be able to connect around safety as well as public health. Our other program is focused on developing business capacity and specifically empowering entrepreneurs and business owners. If you go to the next slide. And this program was designated to identify and address underlying business needs that contribute to the gaps in immigrant business hygiene. This program was born out of the pandemic response, again, thanks to support from public health and wellness. We started with really working with the environmental health department and our food safety inspectors due to the various compliance issues that many of our immigrant business owners were facing during the pandemic. And so at that time, the Office for Globalization designed multicultural competency trainings that were provided both to 50 businesses as well as food safety inspectors. And after that, we were able to work with those business owners to gain understanding of sort of the ways that they could prepare themselves for growth in addition to engaging with a wider public. And so we've really been able to continue this program, again, thanks to public health and wellness and supporting that we're providing opportunities for business owners. Last year, we had about 148 participating businesses. And this year, we had 120 businesses that participated. Again, we were able to continue this program and we'll be resuming these workshops in about another week. Our next area of work is around highlighting the contributions of immigrants, refugees into our community. To go to the next slide. And that is our Journeys of Success program or campaign that's focused on, again, highlighting the immigrant contributions to our cities, diversity, growth, and vibrancy. And each highlight is really focused on providing ways to encourage newcomers to pursue leadership opportunities and to motivate them to be able to see themselves or feel a sense of belonging and a sense of empowerment in the work that they do. Our next initiatives is around promoting our welcoming city certification. And this is our Welcoming Month campaign that you all might have seen mostly during our September. We organize a series of inclusive activities that are focused on promoting diversity, but also highlighting the importance of welcoming newcomers and educating the wider public about our foreign-born population and the need to include them in our various programs and the ways that we would think about the future of Louisville. And so these are some of the events that you may have seen hosted by our office or by some of our partners. Next, if you don't mind going to the next slide. And then something else that was born out of the pandemic is our Global Louisville Directory. And this is really an interactive tool that can help newcomers connect with institutions, businesses, organizations, or services that have higher understanding of cultural competency, and specifically that includes language justice in their approach to the work. And this is available on our website. And in addition to it, we're able to design a global dining passport to help both Louisvillians and visitors learn more about our international cuisine right here in Louisville. And next, please. Again, another program that was born out of the pandemic, language access. If you all recall, a really big component of ensuring accessibility during the pandemic was providing language services, and translating a lot of the information that was coming out of public health department here, as well as the state and federal government, to ensure that we were dispelling myths, as well as ensuring that our foreign-born population was also safe during the pandemic. And so in 2022, Metro Council passed Ordinance 74, which was deemed the Language Access Ordinance, to increase accessibility to resources and services, and to promote a welcoming culture and sense of belonging for our community. And so in the last, I would say, a year or so, we've been developing this program through our Metro government. And really, language access for us is the first step. We believe that organizations must continue to develop cultural competency to maintain a welcoming environment. And that's really putting language justice at the heart of the work that we do. So both putting together or combining language services and language access with cultural humility and competence. Next slide, please. And so in recent years, again, thanks to public health support, we've been able to continue to engage our multicultural communities and organizations working with immigrants and refugees, growing our community ambassadors program that was born in response to the pandemic, but also increasing language accessibility. And in 2 years ago, or 2021, we were able to create a new program that was focused on mental health, mental wellness for immigrant communities. And the aim here was to develop outreach communications through our partners in the community to address cultural barriers to accessing mental health services, or just health services in general. This was also focused on building capacity for our organizations that are already doing this work to be able to continue and expand. Americana Community Center was one of our partners, and they already had a mental wellness program. And so a part of their focus there was to increase their capacity so they can serve more communities. And we were able to provide caseworkers to See Forward Ministries in the Somali community of Louisville, who then were helped to design and bring together communities to provide outreach and education related to mental wellness. From that program, 143 individuals were referred to professional counselors for assistance, and now we're really focused on seeking additional funding to continue this work, so that that need can be met, especially for our refugee communities that are just coming to Louisville, but also many of whom are coming from refugee camps, spending about 15 to 20 years and really not receiving any psychosocial support before they get to Louisville. Really, again, I just want to emphasize that our collaboration with the Public Health Department has been critical in addressing some of the public health needs of our communities, especially those that are newcomers and those that don't speak English or are limited English proficient. And so the Office of Immigrant Affairs, again, works with metro agencies and the communities to engage around best practices for our growing foreign-born populations. And we could not have been able to do that in the past few years without the support of public health and wellness. And lastly, if you don't mind going to the next slide, we believe that Louisville Metro and local organizations can benefit greatly to inclusion policies for our immigrants and refugees. I do again want to highlight that public health has been able to do that in a way that is empowering, but also from a humble perspective of engaging and including our newcomers. And so really want to give the public health department that shout out in being able to maintain a growth in their engagement, as well as capacity building. And so just in closing, really want to highlight that these benefits are good for us, but also for the community as a whole. Our immigrant population is highly educated and really wants to be engaged. And so thinking about ways that we can engage, especially those that have, skills and various resources that can provide to our boards or to our agencies is essential. About 21% of our newcomers are hold a bachelor's degree compared to 20% of our native-born populations. And then again, 17% hold a professional degree compared to 14% of native-born. Again, we're just engaging our skilled immigrants and offering professional fellowships or apprenticeships are ways that we can better engage our newcomers. I'm sure you all are familiar with the shortage of healthcare workers, and we know that there are a number of healthcare professionals that are coming as immigrants but are unable to continue their work in the profession that they have chosen. And so providing these opportunities is essential so that we can build out the capacity for the community as a whole. International student retention is another way that we can engage our foreign-born and international population, as well as including workforce policies that include both newcomers and those that have been here for a long time.
To wrap up.
Yes.
Yeah.
Again, yeah, thank you so much for having me and my colleagues here. I saw a question from Deputy Mayor George. Where do you see opportunities for immigrant inclusive policies focused on advancing health? Thank you for that question, Deputy Mayor George. Again, I think one way is to develop that inclusivity, and that could mean from hiring international professionals or providing opportunities for international professionals to be able to work with our existing programs and agencies to bring in that cultural understanding, as well as sort of that wider experience with working with diverse communities. But I think the other way is to design programs that are not only focused on inclusivity, but also that are focused on addressing and recognizing the gaps that exist. I mentioned refugees. The average number of years that refugees spend in a refugee camp is 15 to 20 years, and so really that's a huge gap that for communities are coming in terms of access to health that they're not receiving at the onset as soon as they arrive in our community. I believe, if I'm not mistaken, Home of the Innocents is probably the only healthcare agency that provides pediatric health screenings for refugees. And that's a huge gap. Again, seeing that about 20 to 40% of our newcomers are children.
Part of that, I might add, has to do with the lack of pediatrician coverage, largely due to Medicaid funding, I believe, that we have. We just have a scarcity in the population for that, which is why probably some of the best coverage is government, either public or private coverage through managed Medicaid organizations or through the Medicaid program itself. Let me open it up for questions very quickly from the group. Your background was outstanding to talk about the outreach that you've done. I think also in relation to Deputy Mayor George's question, and your response, clearly the summer programs and whatever we have in terms of recruiting to this population would be good, as well as outreach to the business community who many of whom in this community under federal guidance, although it's coming under some stress with regard to diversity, inclusion, et cetera, and equity. So, board, questions for the director?
This is Delanor. I have a question, Amos. It's very good to see you. How can the Kentucky Nurses Association aid you in recruiting and retaining nurses? You know, we need nurses in Kentucky. So what can we do to help you?
Absolutely. Good to see you, Delano, and thank you for that question. I think, again, going back to um, ensuring that those that have the experience and the credentials are able to re-credential and have the opportunity to develop those skills. I think initial responses when you hear about re-credentialing is, well, these people are coming in from a different culture. They don't understand the culture of working here. And as I mentioned, I think one way that we can respond to that is providing those apprenticeship and internship opportunities that would be able to give them that initial experience of working in a new culture. But also, there are a lot of public policies that we can advocate for at the state level, specifically around licensing, to be able to loosen those restrictions for those who are not educated in the United States to be able to continue working here. I know that some of our universities have provided accelerated programs or other programs that are focused on trainings. But I think really opening those doors to not only providing that education, but also an opportunity to have the experience working in the United States is helpful. I know there are a number of cities or states across the country that were able to do that during the pandemic and offer opportunities to international nurses to work alongside nurses here or nurses that were already licensed in their states to be able to do that work. And so really opening up those opportunities, not only for education, but also for that practical training.
Well, you still have my number, I'm sure. So please give me a
There you
call
go.
and let
There
me
you
know
go.
how I can help. We're 90,000 strong, but we don't have enough.
Absolutely.
And clearly, in the processes, are there pieces of the process itself that is governed, hopefully not by the federal government, but something that we could control locally that would speed up system processing that would, those barriers to get, if you will, feet on the street in the right career areas? Those I would urge you to think about. We're running short on time, so I want to be sure that the board has time to ask us some additional questions. But those in terms of public policies, this board always asks the speakers if there are public policies that need to be affected locally, especially, let us know. We can advocate. We are not the people who manage the health department or otherwise lobby, but we advocate for and educate.
Absolutely.
Other questions, Dr. Single?
Hi, Amos. Thank you so much. I'm sorry I was late. Quick question. When it comes to field of medicine, the hardest thing is to judge the proficiency of degrees across different countries, different universities. And that always been the challenge. It's not just the culture, it's just also the training. So have we considered to put a structure in place to bridge the gap and accelerate somehow maybe a complete structure? If you already have a degree, then you spend an year, and work with the nursing schools here or the nursing association, put that in place so they don't have to do 4 years of nursing. They can be a 1-year nursing proficiency accelerated program or some sort of program that will give everyone peace of mind and also help us recruit more nurses.
Again, thank you. Thank you for that follow-up question, Dr. Single. I think I'm not completely familiar with the processes for the license, the licensing processes. But the one thing that I would mention that we've seen over time for many of these professions that are technical is that the the licensing board policies are not always, they don't always recognize that international experience. And so, yes, to your question, there are ways. I think that's one way that we can open up opportunities locally, if possible, through the licensing boards. They don't know that's something that we can lean on you all to help us process. But whether it's providing, a supervised, practical training, in addition to education, while somebody's, earning, close to what they will be able to, or they would earn, while they're going to school or developing their new skills, but really recognizing that experience, not something that's different, but something that's different as a deficiency, but something that's different as an asset for our community, so that they're developing the practical skills needed to work in an American context, but also developing the skills that they've gained through education or through their previous work in another country.
Thank you.
So,
Other questions from the board? Yes.
So, for me, as someone who is primarily, I mean, solely English speaking, but engages oftentimes with our large immigrant population, I think one of the biggest things as a healthcare provider for me is that there's the language barrier. And I just am curious to know if there are any like preferred tools like Google Translate or resources for healthcare providers as far as language access? Like, do we have any kind of programs? Is there like a night that I can come and meet up with like some people that'll just give me, opportunities to engage and communicate just so I'm better able to even just recognize, the native languages outside of Spanish? We have a very large Cuban and Mexican population, and luckily for me, many people are proficient, or bi and even multilingual. But some of these other immigrant populations where they may speak two or three languages, but I don't know, or I'm not easily able to recognize what they are. I guess my biggest question would just be what tools are there, or what kind of things can I use to help increase um, that language access and the language justice.
Just about a 2-minute response, if we could. We've got some providers who have to go, and so I think we
Yeah.
probably could talk about this all day.
Absolutely. I think
So
I'll just be very quick to respond to that question is that, first of all, that Title VI of the Civil Rights Act, again, requires um, recipients of federal funds and those that are working. Specifically, I know hospitals have this responsibility through Title VI to provide language accessibility to patients. And so, just the quick answer to your question is that, within Metro we are developing a language accessibility, and and tools that are available. I know that nationally, many practitioners are looking at ways that AI or growing technologies can help with that. But the one thing that I would mention is it's really difficult, especially in public health or health sciences in general, to um, consider language access without that culture of peace, because you have a number of sort of interpretation issues that come into play when you're translating or interpreting from one language to another, especially around the anatomy and sciences. I always really help, especially healthcare professionals, to understand that the translations and interpretations are not always direct. And so that's where it's helpful to have somebody from another culture to be able to interpret. In my native language, Kirundi, for example, when you're saying that you have a stomachache, the direct translation is "I have snakes in my stomach." So again, if you know, I was using it may be technology or somebody who is not a native of my home country of Burundi, is not familiar with the culture, they would interpret, you know, I have a stomachache with I have snakes in my stomach, right? But when you're familiar with that culture, then you're able to differentiate the difference between I have a stomachache and I have snakes in my stomach. So really, some of the tools that we've that are developed nationally, I know there are I speak cards, which are the identification cards for, you know, people who are coming in to be able to identify the language that they speak. But beyond that, you need to be able to have the infrastructure built into your organization to be able to provide that translation or interpretation when needed.
Thank you.
On offline, I'm happy to share some other resources from our national partners, but also some of the tools that we're developing locally.
Beautiful. Thank you, guys. And thank you, Amos, for an enlightening and instructional, highly instructional conversation. We appreciate the work that you do. And if there are at times items that you think would be of interest to the board, we know that you will get those to Deputy Mayor George and we will get them considered. Thank you so much.
Absolutely. Thank you so much for having me in our office.
Great. A couple more items here for from the chair's desk. A special shout out to Kroger's for their support of and partnership with our Healthy Start food program, covering over 800 qualifying mothers and fathers to improve maternal and early childhood health outcomes. Spring break for schools in Jefferson County falls the first week of April, which includes the day April 3rd, which is our April board meeting. So with your approval or non-disagreement, we will move that date to the following Wednesday, April 10 at 8 a.m. Any issues? Hearing none. Let's see. Let's go to the, let's see, is there anything else, Dr. Single, very quickly, just a minute, that any key issues you're focused on of interest to the board?
I think the only thing worth reporting is that we are working with, actually, I'm at a JCPS school right now, doing some vision screening, but we are making some headways in the vaccination gaps. We have more data, we have more stuff, we have talked to more stakeholders, but this is not a 1-minute conversation. Maybe I can update the board next meeting, because by then we will have pretty much everything in place that we can sort of discuss with board what we're doing, and we will go from there.
That sounds great. And if you can come with a list of what you think is necessary, and we'll have a pre-read for everyone so that we can expedite conversation, because it's one, quite frankly, that we've had year after year and not found an actionable, executable, measured way of getting rid of, crossing that off of our list.
100% agree.
Okay. Thank you. Let's move to, hang on, I've lost my place here. Ms. Mendel, your report
Yes.
on the data dashboard. Simply, everyone has it. It was part of the pre-read materials. What high priority items are on there? And then what are the department's key priorities for the next 45 days. Just a couple minutes.
Yeah, I did wanted to touch on, you mentioned advocacy. In the top of the report, we've listed the Healthy Start funding, which is up for elimination through HR 5894. So this is our maternal child health program. We do extensive home visits with our families in Louisville living in the zip codes with the worst and some of the nation's worst infant mortality rates. These are 9.17 infant deaths, black or per 1,000 live births of black children. So very concerning to us. So and just the outcomes of our program. So as we work with these over 835 women, children, fathers, these families, 95% of our participants through the program have health insurance. 80% have a usual source of medical care. 99% are screened for depression and interpartner violence. Over 80% report breastfeeding with their child. So this is just a critically important program. We connect them to clinical, non-clinical health services, maternity care, doula services. So this is a phenomenal area that we ask for advocacy and supporting. I quickly on our
Let
data
me
dash.
stop you
Oh,
one
go ahead.
second, if I could.
Yes.
If
Mhm.
you will, I think, and I'm going to look at everybody here, if there's no objection, if there is a statement of policy that we could share and do our usual distribution to members of Metro or whomever, uh, uh, and our local legislators, we're happy to do that, but we need a position statement for the board.
Okay.
And if you'll get that to me, then I'll share it with everybody and we can sign on and have it sent, so we're not violating the law. Hopefully, now we have said that correctly,
Okay.
and, thank you.
Absolutely. I will share that. You mentioned the data dashboard. So that's been several years work into the making. And this is live interactive data that will be updated annually, at least, maybe more often. So currently we have the health outcomes for accidents and injuries, Alzheimer's disease, arthritis, birth outcomes, like I just mentioned, cancer, heart disease, and homicide. So this is Louisville specific data. You can draw down into zip codes and areas and comparisons. So please share this information as you make decisions with other decision makers in the community, and those are seeking grants. It's hugely helpful, and more to come on that. And then lastly, I did want to touch on, we're beginning our community needs assessment. So if you are invited, you will receive something soon. Please participate. This community needs assessment will then create our community needs improvement plan. This will hugely impact our strategic plan in Healthy Louisville 2030. So again, as we reach out and ask for participation, please agree to participate or forward to someone in the community. We want the whole community's voice on this.
And look here.
Okay, Dr. Single, did you want to? Okay. All right, thank you.
Thank you, Ms. Mendel. Appreciate that. And guys, you have the link to the dashboard. At this point, is Ms. Manson on, and is there anything you'd like to add? She shared with us the KNA's legislative priority list. Is there any additional information you would like to share?
I would like to ask for the members of this board and guest to call their legislators related to the list. And has the list been shared with everyone, or?
It will go out in the post-meeting notes.
Okay, great. Because many of the things that we have listed impact health and healthcare, including bills that are focusing on immunizations, to not require immunizations, not support immunizations. Also, bills that are related to diversity, equity, and inclusion will impact the individuals that we will be able to recruit and sustain in the nursing profession. So if you will look at that list, you'll see the KNAs focus, whether we are supporting or opposing these bills, and we have the rationale for why we are supporting or opposing. And we would appreciate your calls to your legislators to let them know how to vote.
Thank you. Let's see, family health centers, very briefly. Actually, Ms. Shoemaker.
I don't have an update for family health centers, but our outreach and coverage coalition meeting is scheduled for Monday, the 12th at 4 o'clock. It will be a virtual meeting. We will be discussing the Medicaid recertifications. Thankfully, we have seen the state implement some flexibilities that have increased the number of successful Medicaid recertifications and have decreased the number of procedural terminations. So things are moving in a good direction there. We also had a very successful end to qualified health plan open enrollment. We are seeing enrollment numbers back to what they were before the pandemic. So we will have some good news to share at the meeting on the 12th.
Okay, thank you. And Dean McKinney, I don't know if you were on during the time in which I mentioned the new incoming Dean of the School of Public Health and Information Services, Katie Cardarelli, and thanking you for that. Is there anything else from the university we need to know?
Nothing else at this time. We're in active discussions with Dean Designate Cardarelli. She'll in fact be on campus today for some planning meetings with us. Thank you.
And let's see, Dr. Smith, Ed Smith, any updates?
Well, I know you're running out of time here today, but I did just get back from a global funders meeting on the future of food, and I think there's a really interesting window that's opening at the intersection between Food is Medicine, which is a White House and American Heart Association and Rockefeller Foundation initiative, and all the issues around food systems and climate. So at some point in the future, I'd be delighted to share a little bit more about kind of where that might intersect with Jefferson County.
And we have you, the chair has you scheduled for a perspective session in the next couple of months to talk about it much more specifically.
Great, thanks.
And let's see, Deputy Mayor George, do you have an update?
Thank you, Chair. First update I would just give is how fortunate I feel to get to work with the Metro team this morning, getting to hear Amos's presentation, and then of course the updates from public health leaves me with lots of inspiration. So that's the only other update I would give, and really I would ask.
You're fading in and out. Or maybe it's me.
Share more information. Mayor Greenberg is very focused on to ensure our tobacco license. I'm not sure what.
Can people hear her?
No.
No, we cannot hear you. Tobacco licensing, and Ms. Mendel, can you work with her and see what we can do about that? And I now see you, but we can't hear you.
Yes, I will say that the health department is working with our alcoholic beverage control agencies and others to do increased surveillance on tobacco and vaping businesses. And then moving forward, there's some settlement funds to increase that. Deputy Mayor, is your audio working better now?
I don't know. I think.
Well, let's work out to make sure that there is a channel that where This issue is arising, that we're all over it, so to speak. Sorry, Deputy Mayor. Others? No one else. All right. Well, as I mentioned, our next meeting will be March the 6th. It will be, the subject is child trafficking. And we thank again our speaker today and all of you. Any community advisory board or board members, any reports, news, announcements? Well, with that, if there's no objection, we will adjourn the meeting at 9:06.
Before we
Yes.
adjourn, I'm sorry, I just learned yesterday that there was an active missiles case at the Cincinnati airport, and that was just identified. So just promote, within our influence fields, the importance of vaccination.
Okay. Thank you. It's a good way to close. The meeting stands adjourned, and I will see everyone. Gosh, it's hard to believe. Next month, March. Wow. Take good care, stay and be well. Comments and everything get to me. Appreciate it.
Thank you.
Thank you.